So I'd like to thank my fellow classmates, Dr. Palumbo, for taking the time out to watch this presentation. I thank you for your feedback and your constructive criticism. So my name is David Block. I'm an assistant director on a medical surgical unit in a hospital system based in centrally located North Carolina. So when I first started out as a nurse, when I had just gotten out of orientation, there was a nurse on our unit who was a very experienced nurse who was known for eating her young. And typically when you were getting a report from her, she would turn her back to you. And anytime you said something she didn't appreciate, she would take a deep breath. And one day, when I had forgot to do something, in report, she turned to me, looked me in the eyes, and said, "These are things a good nurse would do." Now, can you imagine, as a new graduate nurse, hearing those words? It shook my world. So the question I was left with throughout my 14 years of nursing is, what if new graduate nurses were given proactive tools to deal with these difficult, emotionally charged situations? So my belief are these are learned skills. And through this class, this will develop those skills. So in the southeastern United States, according to the CNO of a centrally located hospital in North Carolina, there'll be a 25% nursing shortage. So the International Council of Nurses predicts in the next few years a half reduction in the 27 million nurses internationally. For new graduate nurses, there'll be 18% that will change jobs or professions in their first year, according to Lockhart 2020. Burnout is at the bottom of all this. Burnout is related to emotional exhaustion, depersonalization, which can be enhanced through promoting friendly interactions, according to Gwens et al. 2019. So screening nurses psychologically through a personality assessment can provide information for nurses that are at risk of burnout, according to Miguel Puga et al. 2021. So after completing an evidence-based and organizational learning needs assessment, it was determined that new graduate nurses would benefit from a personality class that has been shown to improve retention, emotional reactivity, resilience, and relatedness. So this is a shift from what Cone Health has typically done. So typically they're given tools to deal with stress after it has happened. This is a reactive approach. I wanted to shift this approach to more of a proactive approach to give the tools to new graduate nurses to be able to mentally rehearse these scenarios and know how to deal with them when they come across them. So for this innovation project, there'll be 20 new graduate critical care nurses in one class, and then another 20 medical surgical residents or nursing students, new graduate nurses in a classroom setting. There'll be a pre-class assessment and resources. The pre-class assessment will be a DISC personality profile assessment that they will be given a link to take the personality test. So the class will start out with a content lecture where I'll go through all the different personality types: the dominant, influential, stability, conscientious, and compliant. So we'll go over all the details of each and every one of these personality types, and then we'll split into groups based on our personality types. So there'll be a discussion of difficult emotions that typically each individual personality type will typically face. Next, we'll move on to scenario-based questions, and we'll conclude with 4 Likert-style questions. So after the scenario-based questions, there'll be a debriefing period, kind of sort of what they do in simulation, where you walk through and you talk about how you reacted and how might you better react in the future. So the theoretical basis for this innovation project is to improve autonomy, belonging, and competence in new graduate residents as far as personality, their knowledge of personality. So autonomy, belonging, and competence are components of self-determination theory. By taking a personality assessment, SDT postulates that under duress, individuals will be better able to react to stressful events due to better adaptive coping mechanisms, according to Migliorini et al. 2019. In 2020, Rossler et al. Found that interprofessional socialization or relatedness was found to be foundational to new graduate nurses during their transition to experienced nurses. So SDT is similar to Maslow's hierarchy of needs, but it occupies the higher order of psychological needs on Maslow's pyramid. It, however, is a little bit more specific, I believe. Where Maslow's has self-esteem, SDT says you build self-esteem through competence. Are you doing a quality job? Are you getting the job done? Are you accomplishing tasks? Are you moving in the right direction? This builds self-esteem and motivation. So then there's belonging, which kind of directly translates to Maslow's, but it basically says that individuals have to find a social environment to experience what they've learned and to see how it reacts in a real world setting. So the final tip top of the pyramid is self-actualization, which SDT says is related to autonomy. Autonomy is related to control, how an individual feels in control of their lives, but also the environment around them. So this all relates to self-actualization because self-actualization all has to do with an individual taking responsibility of their own learning environment, choices. It's all related to self-regulation as well in the educational literature. So in the class, the three phases are related to SDT. The lecture portion is related to building competence. The discussion deals with interrelatedness, belonging, building that sense of belonging. And then the final portion, the scenarios, help take what the learners have already worked on and decide what they would do in the real world or pretend like they would react to these situations. So this builds autonomy because it allows the individual to see what in the future they may do. The intended outcomes of this innovation project are that new graduate residents will improve their knowledge of personality as well as be able to identify and implement what they learned in their interactions. There'll be a formative evaluation through discussion where the students will be guided and asked probing questions to uncover these emotions so that they can emotionally rehearse these emotions prior to encounter them. So then there will be a cognitive evaluation through using an evaluation through a QR code, which the students will scan in and answer the scenario-based questions, which will be followed with a debriefing so that learners can learn what they might have done better in the future when they encounter these situations. And then finally, there will be an effective evaluation, which is a Likert scale. Likert scales are good at measuring hard to quantify data. So the hard to quantify data would be how the learner perceived the class. Did they think that this would be valuable in the future? Did they enjoy the class? Do they feel like this class would lead them in other directions? So I'd like to thank you all for your time in reviewing this presentation, and I truly appreciate you taking the time out of your day to giving me constructive feedback. Thank you.